To implement our intervention, we chose multiple routes to follow. The first would be to conduct mental health assessments using a weekly self-monitoring questionnaire. This will help track mental health changes to make sure the patient's mental health is improving. If there are any sudden negative changes, it also allows for a psychologist to step in and get a deeper understanding of what is happening, as well as provide more one-on-one treatment with the patient to address the underlying issues. Our physical recovery treatment would involve 4 different interventions: environmental, social, informational, and behavioral. Each of these connects to seamlessly pull power together. Our environmental intervention would include community-based organizations for women in remission, as well as a subgroup for women who are still in treatment. By giving the women who are still receiving treatment their own plan, it associates the gym and exercise with positive experiences. This increases the likelihood that they will move on to the next program once they are in remission. Before remission, exercises would involve light movements to help with agility, like yoga. Both programs would be run by an exercise physiologist to ensure everything is running smoothly and safely. These programs would also be conducted as groups, which leads into the social intervention. Every treatment would be run as an unchanging group. This allows the women to form relationships with each other and give them one more reason to keep coming back. On top of that, the women can meet others with similar stories as them, and new, strong friendships can form to keep each other motivated. One day a week will also include a group discussion. This allows the women to meet in a setting where they can talk more deeply about their goals and achievements, as well as to ask the exercise physiologist any questions they may have. Weekly check-ins can be conducted to make sure that everyone is on the right path with the right information. This will also give them the knowledge to exercise on their own when they're ready. This transitions into our informational intervention. We are using a mass media campaign. Posters will be put up around the hospital advertising the program and what it is meant to do. In the oncology department, pamphlets would be in all the waiting areas along with the check-in desk. These posters and pamphlets will include positive visual aids and information about how this program can benefit physical and mental health for our target population. The behavioral intervention follows along with the social intervention as well. During the weekly discussions, goal setting and self-monitoring can be managed. Each woman should set her own goals on her own time, like decreased blood pressure or increased strength. Self-monitoring will also be utilized for the mental health portion of our intervention, discussed at the beginning of this video. This entire program will be conducted for 12 weeks total, 4 days a week with half-hour-long sessions. If the women who participate do not see significant recovery in this time, they will be encouraged, but not forced, to continue the program. 2 sessions will be offered during the day, morning and evening, in order to be more flexible for people's schedules. The exercise portion of this intervention will be conducted in the hospital gymnasium because it is a convenient and familiar place for women in remission. The weekly discussions will take place in a well-lit conference room to give a more inviting and relaxed feeling to the sessions.